Hi, Jen. How are you?
Hi, I'm doing great. How are you?
Doing very well, and thank you for joining us. I guess this afternoon we'll call it. It's still light out for both of us, which is lovely. On Rare Awareness Radio, and folks, we're really excited to talk to Jen Swisher this afternoon, and we're going to continue with our series on myositis. And Jen, you have a couple of interesting characteristics about you that I can't wait to dive into. But before we even just do all of that, would you mind just giving us a quick hello and maybe a little bit about yourself, Jen?
Yes. Hi. First of all, thank you so much for having me. It's really, truly an honor, and
You're
it's just
welcome.
always nice to be able to share my story and hopefully reach a couple people and help them out. I was diagnosed with dermatomyositis,
Hmm.
specifically the autoantibody TIF1 gamma, approximately 3 years ago, but we think the disease had been going on for about 5 years total.
Hmm.
I am a working PA, physician assistant in emergency medicine, and I also teach full time at a PA program. And I am a mom to three little girls, 10, 6, and 3, and
Wow.
married to my husband, my college sweetheart, my husband,
Aw.
who is a firefighter. So a little bit about me. And I'm here in Southern California.
Did you meet in the healthcare setting, emergency care setting?
No, funny
Oh,
enough, well, we met at a toga party. That's a fun fact.
that's awesome.
And he was a financial advisor who made a
Oh,
career change
pivot.
pivoted right before the pandemic started. It was fantastic.
That's outstanding. I know so often of how like emergency personnel in hospitals and firefighters tend to tend to get together, which is really fun.
Oh, I
May,
know. A lot of the doctors I worked with used to think, just by inherent, they just thought he was a firefighter because so many of us were married to one. And I'm like,
right.
no, he's in finance. And then now he is. I'm like, well, that just will confuse people. But
I'd like to actually start on your sort of inspiration to pursue a career in healthcare. You and I are both healthcare professionals. I'm not a clinician, but I am a healthcare professional. I worked in public health, data side of health. I teach public health at the University of Massachusetts. So, what led you to kind of, UC Irvine, your path to being a physician's assistant?
absolutely. So interestingly enough, in high school, I dated a guy and his mom was a pediatrician, and I just loved that she worked with children and just the medicine side of it, and it intrigued me. And so I
Yeah.
kind of almost threw a dart at a dartboard and said, "I'm going to be a pediatrician or a doctor when I
Mm.
grow up." And it was one of those situations that I just kind of blindly chose it. Got into UC Irvine initially as a cognitive science
Oh,
major, just interested in psychology and human behavior because I was told don't start like kind of pre-med, just do something that interests you in the beginning. And so I started taking the biology courses and things like that at UC Irvine. And funny enough, it was impacted to where I couldn't change my major over. But at that time,
wow.
this is a nice little link with you, is they were opening up the College of Health Sciences with a bachelor's in public health. And
Okay.
so and I already done a lot of the prereqs for the bio and
Mhm.
chemistry, and so I started taking the epidemiology courses and fell in love with it, just studying it. And at that time, I was trying to get my pre-med experience, clinical experience in, and started scribing in the emergency department.
Oh, cool.
And that's actually when I was introduced to the career of a PA and
Mm.
started looking into it a little bit more. So that's just kind of how it all ended up working out. I tried to take a couple finance business classes while I was at UC Irvine, did terrible at them, wasn't interested. I even did an internship like at Mercedes Benz.
Oh, wow.
Yeah, it was just, but I just couldn't get into it. And I just found myself attracted more to medicine every time. And I'm like, well, I guess the dartboard theory worked out. And that's actually really what I loved and was good at. So,
That's really awesome, and
yeah.
physician's assistants is such a great role, and certainly now, and I know you specialize in a particular aspect as a physician's assistant, which we'll get into, but with the primary care shortage and just so much of a necessity for physician extenders like yourself, it's such an important role right now. So thanks for doing that. I guess is what I want to say.
Absolutely.
Yeah.
Thanks for knowing that and for recognizing it. I appreciate it.
I think another thing you and I have in common is we both spent some time in industry. I spent time at McKesson Pharmaceuticals. I mentioned before we went on air that I worked in doing a little bit of oral chemotherapy administrative research on the pharma side for AmerisourceBergen. And you were at Eli Lilly for a little bit too.
Yes.
Yeah. Yeah.
Yeah, that was an opportunity to buy myself a little bit of time. It was kind of funny. During undergrad, I hadn't chosen the PA path completely. I was really torn between MD, becoming a doctor and going medical school versus PA school, and wasn't quite sure what I wanted to do yet. So I had a friend who had graduated a year ahead of me who was working with Eli Lilly, and he goes, "Well, even though you don't like business, you're a pretty good salesperson and you
Yeah.
have the medical background." He
Yeah.
goes, "So
Good
I think you
combo.
should." So he's like, "You should give it a shot." And so and this was terrible. This was 2008. This was like the recession.
Heavy.
I can't even.
Yeah.
Ugh, it was just bad. But I landed a job, moved to Vegas for a year selling um, osteoporosis drugs as well
Mm,
as some other ones. But I learned a lot and fell in love with the pharmaceutical aspect of it, really got
mm,
to know industry, but really felt that itch to get back onto the other side because there was so much I couldn't say to the doctors I was talking to. Like I had to speak on label. But knew so many great things that these drugs could do. And it
mm.
was really at that time that I kind of had that light bulb moment that PA was
He
really
was.
what I wanted to do.
Mm.
And
And
so, yeah,
you kind of went pediatrics to or emergency to pediatric back to emergency. Do I have that right? Was that kind of how it flowed for you?
a little bit, yeah. So I started off with my undergrad experience for a while scribing in the emergency department. And
Gotcha.
so when I was done with Lilly, I went back to scribe because actually what it was a voluntary exit plan. I don't know if you're familiar with those with industry, but because of the recession, they essentially asked who was willing to leave. And I
Who was
said,
willing
I'll
to go?
take the
Yeah.
severance because I was applying to PA school. So I went back to scribing, but I was sent off to different emergency departments to recruit and set up scribe programs in Chicago and
Mm,
the Philadelphia area. And so I did that, got into PA school. Right out of PA school, I started working as a surgery PA, and that was in pediatrics at CHLA, pediatric plastic surgery, which parlayed into then breast surgery.
wow.
So I worked with a breast oncologist and plastic reconstructive
Mm,
surgery, and then that parlayed into trauma surgery afterwards, which then led me back to the good old emergency
back
department,
to the
which it's
emergency
like,
department.
and I'm like, well, I tried to avoid it like the plague, if you couldn't tell, but I'm like, it's just home. I love it. So,
Yeah. Yeah, well,
yeah.
such a long history you had too in sort of the perioperative surgical space moving across, but really you were focusing on a lot of chronic disease, too as well, it sounds like, with oncology and other things, yeah. It's really,
I got
really
a
ama
little bit of everything.
yeah, yeah,
Which actually has served me well being
mm,
back in the emergency department. Some of these
sure,
really niche things that my colleagues like never see. I'm like, oh no, I can take care of that. I'm like, I know what to do. So
um,
yeah.
so you're moving along, you're working as a PA, but all of a sudden I don't wanna say all of a sudden, I want you to put it in your words, but these initial symptoms start to pop up, I guess, Jen.
Yeah, that's about right. Yeah, and I'd say about 2019,
Mm,
2 of the triggers that it's kind of one of those like I guess we'll never know which one it probably was. I went to on a vacation to Hawaii
mm.
right before my second daughter was turning 1 years old. So we were there for a whole week in the sun and having a great time. And then shortly after we returned, we had her first birthday party, which, if anybody knows, is just a great petri dish for viruses. So picked up one of those famous first, 1-year-old birthday
Birthday party
viruses.
viruses, yeah.
Uh-huh. Yeah, the gift that keeps giving. So then I'm like, I ended up, kind of developing like just I was just really sick. Like you would have swore it was COVID before COVID was
COVID,
a thing, but but it was a little too early for COVID, but it was really bad flu virus type situation. Knocked me out. And then and then after that, like things just kind of went downhill to where I wasn't feeling well, but I couldn't put my finger on it. And then it was a few months into that where I finally waved the white flag and asked my primary care PA for a referral for rheumatology. I was like, I really think something's
was it
autoimmune's going on. So I was
joint?
starting to get
Yeah.
joint pain. I was having some like rashes. The
Mm.
fatigue was the big thing. I felt like I was in my first trimester of pregnancy again, and I wasn't pregnant. So just a lot of vague, weird. I was losing hair. We were like, is it my
Mm.
thyroid? What's going on? So she ran a panel of tests. Things came back kind of borderline, sent me to the rheumatologist. The rheumatologist ordered more specialized tests for the garden variety things, not the rare things. And everything came back relatively normal or just not enough to convince her of anything. And at that point, she's like, "You don't have an autoimmune condition. I think you're just a mom and you're tired and you work the night shift and, just maybe
Yeah.
rest a little
Maybe
bit
get more
more."
rest. Yeah.
Right.
Yeah.
I'm like, that's that, but I've also been working in at the night
Yeah,
shift
you
with.
you you had a lot of, you had a lot of years of experience at that point. You were probably at the top of your physical condition as well, I would think, right?
Right,
So,
right,
yeah,
and that's why
yeah,
it was just bizarre, but I mean, what are you gonna do when you've gone to the specialist and they ruled supposedly everything out at that point? I just kind of accepted and I'm like, "Okay, well, maybe this is just how it is after your second kid, you get this tired." Like,
yeah.
so I just kind of accepted it and moved on and figured out other ways to kind of compensate and be okay, and then COVID hit.
Mhm.
And, the pandemic working on the front lines is a big
Sure.
distractor, and a lot of that's like, is this
So you're just
burnout?
putting through. Yeah, yeah.
Just pushing through, exactly. I was, put on some medications for essentially, like, almost like chronic fatigue, like, we tried a lot of, like, the, what do you call them? We tried some stimulants and so, like, modafinil and couple of those things for, like, narcolepsy type situations. We were looking into sleep disorders or, like, maybe you just have shift worker. That was essentially what they had come up
Oh,
with is,
the
like,
shift
maybe
worker.
a shift worker cycle, like, disordered type of sleep, and so
Mm,
that's why they tried those things, and it got me through from the fatigue level. I was able to, like, still function, but my body just didn't feel right
yeah.
still. And so it was one of those situations that, yeah, that like I said, the pandemic happened and I just pushed through. And then at that point, we were trying to get pregnant with our third. And what I've kind of looked back hindsight is being pregnant is an immunosuppressive state. And so a lot of my symptoms either remitted or were hidden more when I was pregnant.
Interesting.
And so it's kind of interesting to try to look back and wonder. And I actually, just like I did before my first child, not my second one, we had a couple miscarriages,
Mm,
which I'd had a complete workup the first time this happened, and they never found any reason why it was
mm.
occurring. And so I would be curious to know if, like, just those few pregnancies and miscarriages and the DNC I had to have, it just kind of abated the symptoms enough
Mhm.
to get me through. And then it was truly after my third was born in 2022,
Okay.
about 3 to 4 months after she was born, that everything actually then just ramped up to where I couldn't ignore it.
Mm.
So, and that's what kind of brought me to trying to put this puzzle piece together that nobody else was figuring out.
So at that point, well, I guess I got a couple of questions, Jen. So is it common for dermatomyositis to be confused with autoimmune in general? So rheumatoid arthritis or those things? I guess that's my first question. And then
Yes.
you said you got to a point where you couldn't ignore it anymore. So do you go back to the rheumatologist at that point? Like, where do you go from there? Yeah.
Yeah,
Yeah.
great question. So right before I got pregnant with my third, I did go back to a different rheumatologist, but a
Mhm.
concierge one. And he actually is an MD, but he focused a little bit on Eastern medicine as well.
Hmm.
So he's a little bit like, so I was like, maybe he'll think outside of the box
Right.
and stuff. So I went to see him and his theory, like you were saying, my dad has RA. And
Mm.
so he was like, maybe you just have seronegative RA, like meaning that you haven't converted, like because my rheumatoid factor was the thing that was like borderline nor like it was borderline abnormal.
Sure.
So he wanted to start me on treatment, and he actually even prescribed me a treatment for RA. And then I got pregnant and couldn't take it,
Couldn't
and
take it.
so then after when, like you were just saying, when those symptoms started kind of flaring up again, I was like, well, I'll go back to him
Mhm.
and I'll say, hey. But I didn't go back to him initially. What I did in the beginning was I was chasing a couple symptoms. The big ones were the rashes right in
Yeah.
the beginning. And I was seeing a dermatologist and they thought I had rosacea because, again, my dad, I mean, looking back, hindsight's 2020. My dad has RA and he also has rosacea and psoriatic
Mm.
arthritis. I swear he needs to get tested for dermato.
Sounds like,
But
yeah.
interestingly enough, the treatments overlap for RA and dermato, and so I wonder if his symptoms were treated because he
Yeah.
probably had the same,
Because of
but
the
it's not
overlap.
actually.
Yeah.
Yeah, but it's actually not hereditary, so it's not
Mm.
no like, specifically hereditary, and so, so they were treating me for rosacea. I tried, I don't even know how many different creams to get rid of the red rash that it mimics, like you were asking, lupus. It's like the butterfly rash that you
Sure.
get.
Yep.
So that was the big one that we noticed first. And so we were slapping all types of rosacea creams on it that were not working. And then some other rashes kind of started developing elsewhere. And that's when they started to scratch their head. And at first they thought maybe you have a gluten sensitivity, maybe you have a celiac type situation. So they started testing me for celiacs. And then they wanted to take a biopsy after it wasn't responding to steroids. And then at that same time, my right hip was really killing me. I already knew that I had a small labral tear there from
Oh,
a
okay.
few years ago that we just were treating non-operatively. And so
Sure.
I thought to myself, could this be something that like in labor or birth that maybe the labral tear got
Labral
worse and
tear
that's
got
kind of why
worse.
I'm
Yeah.
yeah, maybe that's why it's hurting me and I'm limping around more. So I went to my orthopedist that I usually see and was like, okay, can you get an MRI and see what's going on in there?
Mm.
So he got the MRI while I was seeing the dermatologist. And then at this time where I was like having both things, that's when I'm like, I'm going to go back to this concierge rheumatologist. And he's like, sure, yeah, yeah, let's run some labs. I do think it's probably seronegative RA. And so he started the lab panel for me. And all three of these things kind of were happening within about a week or
All
two of
time.
each
Yeah.
other.
Mhm.
Yeah, and so the first thing to come back was the MRI, and the MRI showed instead of, the labral tear being worse, it was stable, but I had diffuse muscle inflammation,
Mm.
and and so I was like, "Huh, that's weird," and at
Stop.
literally within 24 hours, the biopsy came back from one of the rashes that showed interface dermatitis, which is consistent with an autoimmune condition, specifically
Mm.
dermatomyositis,
Yeah. So that
and
was the
so
smoking gun, if you will, right?
that was me, that and because these
Yeah.
providers weren't talking, so I was kind of almost,
Yeah.
being my
Figuring it
own.
out. Mhm.
Yeah, and so I quickly called the rheumatologist who had these labs cooking, and I said, "Hey, can you add on a myositis panel for me?" And he's like, "Sure, but that's really rare. There's no way it's gonna be that." I said, "It's fine. Just humor me. I'm pretty sure that's what's going on." And then I got a panic call from him about a week later when I came back. I was like, I could just hear the voicemail, like, "You call me back right away." Like, it was, like, not a usual doctor voicemail, and I was like, "Mhm, it's
Mhm.
positive." Like, I already knew.
Right.
And so, yeah, and that's when I got the diagnosis, and that was just about in August. Interestingly enough, like, right as that was all happening, one of the worst rashes happened, like, on my flank, and
Mm.
I like, before I was, like, putting these things together, I thought it was shingles that hurt so bad. I put myself on an antiviral. I'm like, "What is going on? Why am I falling apart?" Like, so and then the rashes really became pathognomonic, like, where you get the Gotrins and all of that. While this was all happening, we did a day at Disneyland where I was in the sun all day.
Oh my
And
gosh.
then it just blew up, and
Lit
I was like, "Well,
Yeah.
this is super obvious now." Like,
Yeah.
so, yeah,
And
and that was I think that was August, 2022. Yeah.
okay, wow.
Yeah.
As I mentioned to you, I spoke to a care partner or caregiver of a woman who has myositis, and he kept describing her rashes as like like shingles, like you said, but like shingles that just do not go away, like just continue to come back.
Absolutely.
And yeah, and interestingly enough, she had also had a significant flare up while on vacation in sun exposure, and I don't know if those
Yep.
are related or not, but in
They
terms
are, they're
yeah.
triggers. Yeah, UV I'd say that's the worst part about my diagnosis.
Mm.
Like, I probably would take everything about it, but I live on the beach, and I have 3 small children with
Still like to
outdoor
be outside.
activities.
Yeah, yeah.
Yes, and it's absolutely impossible because I have to
Mm,
avoid UV exposure like it's,
yeah,
going out of style. It's
yeah.
crazy.
That actually kinda brings me, I think, where I'd like to ask you about next, Jen, is how do you live how do you live day to day now, right? You said so August of '22, so that means we're coming up on 3
Yeah,
years, and so what
yeah.
does your day-to-day life look like? And, of course, I wanna talk to you about the combination treatment you have of IVIG and Rituxan and things like that. So tell me a little walk us through that a little bit if you wouldn't mind.
Gosh, yeah. So I got this like self-diagnosis. I'm sitting here and I'm like seeing this concierge rheumatologist. I'm like, I can't afford to keep paying cash to get treated, right? So
Right,
I've got to
yeah.
find somebody a network. And so I did something I don't typically do, but we have like an internal messaging system within our hospital.
Mm,
And I had asked a couple people who should I go see, and they had referred this one rheumatologist. And so I like kind of backdoor texted her and
mm.
was like, hey, here's all my stuff. I cannot because
Ugh.
every rheumatologist in Southern California had a 9-month waiting list to
Oh,
get seen, and I'm like, I couldn't even get off of the stool at work anymore without,
wow.
like, slinging myself out. I couldn't get because you have to remember, this is August, my daughter was born in February, she was 6 months old,
So, yeah,
I
you're
couldn't get her
3
infant
children.
car
Yeah.
3 children, I couldn't, like,
Yeah.
it's a 6-month-old, you have to hold them. I'm
Mhm.
like, I couldn't hold her for long periods of time standing, couldn't get her in and out of the car from the car seat. I couldn't even blow dry and brush my hair, and so I was like, "This is progressing pretty quickly, I need to get in and get seen," and so she's, "No, absolutely, I'll see you next week." So
Yeah.
that was one of the blessings of being a healthcare provider and being able to backdoor myself. She was like, "Let's get you on IVIG,
Mhm.
right away," because the I mean, it's kind of funny in hindsight, but I was still breastfeeding and I wanted to keep breastfeeding, and a lot of these drugs you can't take
Yeah.
when you're breastfeeding, and I was like, "Oh, it's okay. Oh, yeah, well, IVIG, we can do that." And then serendipity has it that the one person that I was told to go see, she's actually best friends with the department chair of the myositis center at UCLA, which is about an
Mm.
hour away from me.
Sure.
And she's like, "We need to get you into a myositis center because they're just, more well equipped with, like, the research and what to do." So, she was about to start me on just the IVIG. I think I had started on a couple of fusions and that was it. Went into UCLA and she goes, "Oh, no, no, no. This isn't how we have to hit it hard and fast with you. Like, you have a, pretty aggressive case." And so they added on mycophenolate at the
Mhm.
time,
Yep.
and they're like, and I had to discontinue, like, cold turkey, stop breastfeeding right then and
Mm.
there. And so we started that, and then of course I was on high dose prednisone. That was the
Okay.
other one. Got the moon faces, all of it.
Yeah.
It felt terrible, and so but that did the trick to get things to calm down. After it took about 6 months to get it to calm down, enough to where we were like, okay, maybe we can start tapering the prednisone.
Mm.
As soon as we tapered the prednisone, I went into, like, a big flare. Like, it kind of, like, went back to where it was. And so that's when we started kind of thinking about other options because I was like, "I'm not going back on high dose prednisone. It made me feel crazy. We gotta think of something else." So we upped the mycophenolate to the max amount. We upped the IVIG to the max amount. Nothing was really working. I mean, it was, like, smoldering it, but not, like, getting
Yeah,
the
you like keeping the lids on the pots, as they say, right? Yeah. Yeah. Yeah.
Exactly, yeah,
Yeah.
and so we did that for about another 6 months until finally we were like, "You know what? Let's try Rituxan and see what happens." She was a little, skeptical at the myositis center because she's like, "It's typically a little bit better for the muscles than it is the skin, and your muscles aren't like, the muscles actually responded decently, but weren't all the way better." And I
Mm.
was doing some physical therapy at the same time. But after 2 rounds of Rituxan, we finally got into what we'll consider, like, a low disease activity state, which is really all you can kinda hope for with dermato. There's a handful of cases of remission, but it's
Right.
kind of elusive, you know? Low disease activity is really the goal. So, over the last year, we've been able to wean me from 2 Rituxan infusions every 6 months to 1, which is considered maintenance dose,
Mm.
and we've been able to go from 4 IVIG infusions a week to 3, and
Wow.
we've been able to decrease the mycophenolate a little bit too. So,
Wow. God.
and I will say that minus the fatigue of maybe just being a full-time working mom with a chronic disease, um,
And 3 kids.
like, I and 3 yeah, 3 kids and all the things, right? And my husband's shift working.
Yeah.
I feel as good as, like, I feel like I can be. Like, I'm, like, as
Right.
close to baseline as I'll probably ever get, and I
Mhm.
feel like I'm functioning and not, like, struggling. But yeah, that's kind of where I'm at right now, and so we're hoping that we'll do maybe one more maintenance dose of the Rituxan and see if we can wean myself from that, and then the
Mm.
next one will go down a little bit on the IVIG, but their thought is I'll probably be on IVIG for life, and then
Sure.
I may or may not have to be on this mycophenolate for a decent amount of time as well. So,
Yeah, and you had mentioned you had an infusion today, correct?
I did, yeah. So,
Yeah. Yeah.
yeah, so I'm a little sluggish. It's funny, I've been very lucky with IVIG in 2 respects. Like, one of them is that, so typically IVIG is given, like, they do it, like, 3 or 4 days in a row, and I was
Mhm.
like, "There," and IVIG, for anybody who doesn't know, it takes, like, up to 8 hours,
Oh,
especially
it's
when
a
you first start.
very slow
It's a
infusion.
v You have to go very slow because it's very thick and viscous and,
Mm.
all the risk and everything, and there's lots of react rate, dependent reactions that you can get.
Mm.
So, but I was like, "There's no way once a month I can devote 3 to 4 days where I'm working a full-time, like,
Yeah.
job in this infusion center." So we came up with the, "Let's do it once a week." So
Mm.
it's kind of become a part of my schedule now that once a
Right, you
week
just
I
kinda
go
work it
in.
in? Yeah.
Yep. So I work it in, and fortunately, we've gotten it down to a 4-hour rate
Wow.
infusion, and I got a port about a year into my diagnosis, which
Mhm.
I should have gotten much earlier. It's so
Yep.
much easier.
So much easier.
Um,
Yeah, yeah,
it is. It's just, like, less pain, and I was starting to become a hard stiff, which I didn't wanna be.
yeah.
And then, yeah, and I feel pretty sluggish, like, exhausted for that 24 hours afterwards, and
After
then I'm
yeah.
fine afterwards. So
Mm.
I
And
I I got the lucky end of IVIG side effects. Yeah.
sounds like it, yeah. And how long can the Portacat stand for, Jen? How long does that have to be?
Kind of indefinitely, like,
Okay.
as long as it doesn't clog,
Okay,
knock
it
on
it
all the
doesn't
wood.
need to be changed for sterility reasons or anything like that, no.
No,
That's
nope, nope, they just do little heparin flushes on it each week to make sure it doesn't clog up.
mhm.
Yeah, yeah.
We've talked about your role in your journey as a clinician, as a patient, but you're also, we have another thing in common. You're also an educator. You teach at Chapman University, and you're also an advocate. And I'd love to talk a little bit about the work you're doing with the Myositis Association, or TMA, supporting patients, especially young families like yourself. I mean, your children are still pretty young. I mean, my daughter's 23, so I'm very far from where you are, but can you talk a little bit about how your experience has changed as you kind of started to work in medical education and your approach to medical education?
Yeah, that's great. So, the first time I found a platform for
Mm.
this and being able to advocate about dermatomyositis and honestly felt comfortable was a year prior to entering academia. I was actually a medical educator for Hippo education.
Oh,
So it's a
sure.
medical. So they do a lot of podcasting. They
Mhm.
do medical
Yep.
education for PAs, doctors, everybody. And Netta is an amazing physician over there, and she asked if we could share my story as kind of provider and patient. And I felt really comfortable because she's somebody I worked with. She's fantastic at what she does if you've never heard her speak. And so I was like, sure. And I was right at that point where I was starting to finally feel better because I think
Sure.
in the beginning I was just like people would reach out or ask me questions and I just didn't have it in me. I'm like, I don't even know how to navigate this disease yet.
Right.
Like
How
I
can I
gotta figure
help?
this out.
Help? Yeah. Yeah.
Right. I was like, it's like one of those I had to put the oxygen mask on myself first, and then when I felt like I could breathe, then I was like, okay, sure. Like I feel like this is a comfortable platform and I can do this. And so that was the first opportunity I got to share the story. And then I also went to the TMA conference right when I was first diagnosed and kind of met some people and learned a little bit more about it. And then funny enough, you have to do a presentation to, as part of the job interview as a professor. And so I got a really good advice from a friend who was already in academia saying, pick a really rare topic that nobody's going to know because they can't ask you really good, like hard questions and know if you're getting
I
it
wish I
wrong.
thought of that.
So I was like, "Oh, well, I've got a perfect topic." I'm like, "Nobody will ask me a question about dermatomyositis," and so I did a little presentation on that without them knowing that that's what I had right at the
Right.
time. I wasn't gonna be like, "Hey, I'm applying to this job, and by the way, I've got this
Yeah. By
condition."
the way, I have
So I
DM.
d
Yeah.
yeah, yeah, no problem. So I did that, and then, as time kind of went on, I actually had met 2 local people here, because it was really I'd say that the gap is right now with young people who are wanting to get back to working full time, and especially those who work in
And probably need
healthcare.
to, right? I mean,
Right, 'cause that you need to, and it's just a
yeah,
rare disease, so, like, finding somebody my age around here, like a support group or something, was almost near impossible. I got really, really, really lucky that a PA colleague happened to know a local firefighter who was around the same age as me who was diagnosed a
wow.
few years ago, and he met actually a nurse that works at the same hospital as I do who also has it. So 3 of us kind of found each other and we, like, had this little text thread going that provided a ton of support, and I felt like
Yeah.
that really helped kind of motivate, each other to kinda stay in it and share, like, what was working and what wasn't
And
working
how
in
interesting
certain
that, he's a firefighter, you're married to one, the other person was a nurse, you're a PA, like, what a yeah,
at the
crazy. Yeah.
same hospital,
Yeah,
like,
yeah.
all of it was just really, like, really worked out, and so yeah, and then, over the last like, once that podcast got shared with Hippo, that's when the TMA had picked it up, and, I'd been,
Mm.
connected with them over there, and they've been absolutely amazing, sharing my story, asking me to get involved a little bit more, and so we're kind of in the works of trying to figure out what that looks like, whether it'll be more educational series or maybe getting a young person's, like,
Yeah,
support
perspective.
group together.
Yeah,
Yeah. Or, like, just young people or even people in healthcare, like, like MDs, docs,
sure.
PAs, PTs, nurse practitioners, like, and getting a group together because it's a different perspective when you kinda know what's
Sure.
happening to you.
Sure.
So,
And we all know
yeah,
too that sometimes clinicians are the worst patients too, right? So,
we are. We're absolutely the worst. We pick and choose. I mean, there's a blessing and a curse of it, right? Like,
right.
I can kind of dictate some things, like, or make suggestions to things that usually are pretty out there, like that a typical patient wouldn't. Like, for example, like with the TIF1 gamma autoantibody, it's a very high risk for cancer within the first 5 years of diagnosis. It's like what they call a cancer associated myositis.
Mm,
And it's upwards to like anywhere from, and it's any cancer, not one specific.
right.
And it's upwards. Some of the quotes are up to 30-40% risk,
Wow.
right? So you're talking like BRCA related, right? So, but the cool thing about going to the TMA conference is I was able to pick the brain of a great um, guy who's essentially researching my autoantibody. And and I got to kind of talk to him and he's like, look, like anybody who was diagnosed under the age of 40 who has TIF1 gamma, we haven't found one cancer associated myositis case yet,
Mm,
which I was like, first of all, that was really reassuring to hear.
yeah.
Cause that's the thing that freaked me out right in the beginning of getting diagnosed with this. And then two, his big thing is the risk really is there for the first 5 years and then it drops off. And I'm like, look, I have photos from 2019 that really do demonstrate I probably have had this for now 6 years. And so I was able to really advocate for myself this year to try to reduce the cancer screening in terms of like CT scans, radiation exposure, gadolinium for MRIs, all of these things that aren't great for you long term if you have to have them done every year.
Mhm,
Because I was like, look, I'm outside of this 5 year mark. We know that I'm in that under 40 demographic. Like all of my scans for the last 3 years have been clean.
mm,
Could we go with a little bit less aggressive approach here and maybe do some ultrasounds, maybe do some cell-free DNA gallery blood work?
mhm.
And then if something crops up, like one of the rheumatologists here, she's so sweet. She goes, dude, if anybody's going to catch your cancer first, it's going to be you. So
Right.
like, she goes, you're pretty on it. Like,
I think you're staying on
and
top of it. Yeah. Yeah.
yeah. And so I was able to kind of finagle that a little bit. Whereas like, I feel like somebody not in the healthcare field would just probably undergo that screening and
Mm,
not get to advocate as much for themselves. So that's been one of the blessings. But yeah, the curse is being a terrible patient, not necessarily being compliant with things. Yeah.
Jen, I think, you and I could probably do an entire podcast together where we just talk about navigating the healthcare system, right? And the
Oh,
challenges associated with that. But you saw it all, right? Delays in diagnosis, 9-month waiting lists to get to specialists, you're back channeling, there's gaps in telemedicine, there's this lack of sort of rare disease triage systems. Let's talk a little bit about that, Jen, and some of the challenges you've seen. I mean, certainly for dermato and rare diseases, but you see it constantly just for folks also. Like I said, you and I could talk about this not just from the rare disease perspective, but really any patient's perspective, right?
absolutely. I call myself essentially a professional patient at this rate. Like, I mean, I have seen it all, done it all, right? And I think that's like where my heart is eventually when when there are more hours created in a day. Like I feel like there's this gap in between primary care and specifically rheumatology, but also specialists as well, just for any rare disease, right? There's typically to see specialists, there's just not enough of them
Right.
and there's long waiting lists or there's just barriers for insurance or you have to have a diagnosis prior to getting into somebody which doesn't make all that much sense,
Mm,
right? Because a lot of things are out of the scope of primary care or it shouldn't be their burden to bear, like they should be able to focus on primary care. And so I mean, one of my far-fetched dreams is to kind of create some kind of like a platform or telemedicine like triage system that would be able
mm,
to at least get some of these patients who have these vague symptoms or constellation of just like things going on that they can't put their finger on and they can't get into anybody and be able to see them virtually, get some workup started for them to get them some answers, and
mm.
then even potentially depending on what the disease state is possibly get them started on just like a starter kind of pack of whatever it is for whatever disease to get it under control, and then
Right.
have a referral network within that system to
Mhm.
be able to be like, great, we have these handful of people that we can get you into quickly and have that like at the ready to go. Because I feel like that would take the burden off of primary care. It would help patients get in and get seen so much more quickly. And honestly, it's just I don't know how anybody without a medical background navigates this after doing it myself as a PA.
Yeah,
Yeah.
and I think too, you mentioned the platform aspect of it. I think it might be easier too for patients to kind of advocate for themselves through platforms like this because is very hard to advocate for yourself when you're placing a call, you're waiting for the office to call you back. It's challenging to think if there were more real time connections and real time communication
Totally.
opportunities.
Right. I mean,
Hopefully,
it could easily be expanded to where
mhm,
there were people that were willing to call and advocate on their behalf. There was like a good library of resources.
right,
And
right,
I mean, one thing I didn't mention is I'm in a very privileged position. I was able to afford seeing a concierge rheumatologist.
right.
I mean, I work in the emergency department where we treat people regardless of their ability to
It's gonna
pay.
take. Yep.
The amount of people that don't have that privilege to
Mm,
be able to do that, like, and therefore they don't deserve the same care I do. It's just not right in my heart either. So,
yeah.
I do have a propensity that if somebody comes into the ER and they're not getting answers, it's like, look, it's no skin off my back. I'll add those extra couple labs on. I'm not going to follow up with you about that, and I'm going to document it. But they're
Right.
going to be in your chart, and it's your duty to do something with them
You have to take that.
because
Yeah.
I feel terrible. I'm like, I don't know how else people do this. Yeah.
Right. No, it's so true. And I appreciate what you just said too, Jen, about these sort of targeted support groups for young patients, for parents like yourself, kind of building those bridges between the providers, the patients, the specialists, try to streamline all of that. From your kind of hopes and dreams perspective in the rare disease community moving forward, but obviously there's that piece of it. I feel like so many times when I talk to folks like yourself, the funding isn't there, right? So when I
Right.
ask folks, what do you hope for the most? They say, okay, well, I'd love to see more funding, of course, but usually it goes beyond that, right? It comes into advocacy and peer support and education, and a lot of things you've already mentioned. Are there any one or two specific things that you're, particularly aspiring for, Jen, or hopeful for?
Yeah, I mean, I think that I think seeing specifically for dermatomyositis, I would really like to see one of two support groups. Hopefully, be able to start doing that with TMA and either having like a young adults group, working adults, not ones. I know it doesn't sound great, but a lot of the support groups, they're typically people who are full time disabled, which is fantastic. It's just really hard to relate to somebody when you're full
Mm,
time working. And so some kind of an aspect around young people with this condition where they're like really either in low disease activity or their goal is to get there to be able to
right.
kind of pair up with somebody. And whether it's healthcare providers, it would be great because it's a little bit of a nuanced
Mhm.
one. So something with that regard. And then, you know what the other thing would be? It would be some kind of like a child care network to be
Oh,
able to go to
very good
these
point.
appointments.
Yeah.
It would. I had an amazing friend. She's the founder of Metalita Scrubs and White Coat, and during the pandemic, she did this amazing network where I was like, "Gosh, this could get multiplied." But
Yeah.
what she did was, in order for us to go and work on the front lines as medical providers, we needed somebody that was willing to take care of our kids at home.
Yeah.
And so and there were all of these college students that were not having to attend classes. And so she set up this network where college students would come in from local schools and they would watch our kids for free. And essentially, we would mentor them. And they're usually pre med students.
Right.
We'd mentor them, but they would provide
Good
us free
barter.
childcare. Yeah, and we'd be able to go in and do a shift that we wouldn't have normally been able to do otherwise because, like, my husband was, in fire academy or doing whatever. Same situation where it would be amazing if there was some kind of a network where somebody could watch my kids for 2 hours while my husband's on a 48-hour shift, so I can go get IVIG infusions, or I could go to get my screening done, or any number of things like that would support a young mom, would be fantastic to see.
That is such a interesting and a fascinating perspective, right? The idea of like this multiplier childcare, because what an unbelievably necessity thing, right? I mean, just a basic needs thing. It's like should be right on Maslow's hierarchy of needs.
Right, and I'm like,
Childcare. Yeah.
when I tell you I'm a professional patient, it's not a joke. It's like it's
Yeah.
almost like another part-time job
Sure.
going to a lot of especially right in
Sure.
the beginning of the
Sure.
diagnosis, and I am lucky enough that I have my in-laws that are not too far away, that
Sure.
are
But not
always
everybody
at
has
the right
that. Yeah.
but not
Yeah.
everybody has that, or they're busy and they have lives
Yeah.
and need to get something done,
Yeah.
so,
So
yeah, I
true.
mean, that's a fever dream, but
Sure.
you never know.
I like it. I like it a lot. So I'm going to ask you the unfair question, Jen, and you probably get this one a lot. If you could go back to, I guess, 2008 or 2012 or 2022 even, right? What would Jen say? What would Jen now say to Jen then?
Oh, good lord.
Yeah.
Yeah. But buckle your seatbelt.
Yeah.
Like, it's gonna be
Get
a
ready.
bumpy ride.
Yeah.
Yeah, get ready. Yeah, I think, I would have told myself to stay out of the sun as much as I did, that's for sure. I was a
Living
lizard.
in Southern California.
Gosh, I mean, yeah, but I was like I mean, I grew up in the era of sunbed tanning and, like, in sunning in your hair and, like,
Mm,
grease and, like, banana boat in the backyard.
yeah.
Oh my gosh, if I could ever tell I'm like, "You should see me, I'm slathering my kids with sunscreen
Sunscreen. Yeah.
constantly now,"
Yeah.
and, so I was like, that would probably be the number one piece of advice I'd give, but, I mean, and you know what, like, it's funny because a lot of things, like, you can't I mean, I always say everybody is dealt a deck of cards in
Mhm.
life, it's just a matter of how you play them,
Right.
and so I never thought I was gonna get out of, life alive because we don't, none of us do, right?
Mhm.
So, I knew it was always gonna be something that was gonna happen, and so I do count my blessings on 2 things, that number 1, it's a treatable condition that I have, right?
Right.
And that number 2, it's me and not one of my children. I have a niece with cystic fibrosis, another rare disease,
Mm,
and I couldn't even imagine having a child and being a mother, like, you always wanna take that pain away from your child, the
course.
disease away. So, I'll take this every day of the week if it
You'll
means my
transfer it onto
children.
you every day of the week. Yeah, I
Yeah.
hear you.
So,
Yeah, I hear you.
it's a little bit different of a retrospect, but
Yeah, no,
I yeah, it helps.
it's meaningful. No, it definitely helps. And I guess the other question you probably get asked too a lot, Jen, is when you meet someone who is newly diagnosed, how do you even what do you even say to them?
I know. I just there's a knowing look,
Mhm.
really
Yeah.
interesting story, and it's super crazy, but, I mean, just talk about how rare it is, but it is my 4th connection here. So my husband, I told you, works as a firefighter,
Yep.
and, one day he was on a call, girl fell off her bike and injured herself, and, he's the firefighter, he's not the paramedic, but he overheard the paramedic getting her history, and she said, "IVIG," and he goes, his ears perked up,
Yep.
and he's like, "What?" And then he's like, "Can I ask you why you're on IVIG?" Like, it just she goes, "Well, I have dermatomyositis," and he's like,
Yeah,
"No,
wow.
you don't," and he's like,
Yeah.
"What?" And so she was at and funny enough, I was working at the same time he was in the emergency department. He goes, We're gonna send you over to the emergency department right now, and I want you to go look for my wife and find her and ask her about it." And so so I did have that opportunity actually to meet somebody, and it was one of those just kind of knowing looks, and it's just like, "Hey, let me know what I can do to," like, I'm in a position now where mine is well enough controlled where I feel like I can be a support to other people.
Right.
And so it's like, what do you need? Is it resources? Do you just need to vent? Just kind of meeting them where they are and seeing, what it is I can do to kind of give back to those who gave back to me in the beginning.
Yeah, that's beautiful. And I'm sitting here, Jen, and I'm counting in my head. We all wear multiple hats, and we all play multiple roles in life. But for you, I'm counting mom, I'm counting spouse, clinician, educator, patient, advocate. I mean, this just goes
It's a
on and
lot.
on and on. It's a
Yeah.
lot. So, with that, I'm just gonna say thanks. Thanks for doing that. Thanks for this burden, but I know it probably doesn't feel like a burden because you've just do it every day, right? But thanks for doing all that. Thank you.
That's really sweet
Yeah,
of you. Thank you. Yeah, and when people summarize it or like go, "How do you do it all?" And I'm like,
yeah,
"You know what? Just like everybody else does,
yeah,
one
just
foot
like
in front
everybody
of
else
the
does.
other."
Yep,
Just
every
just
day. Yep.
I don't look past pretty much the next 24 hours, and that's how I get through my day. So, I was like, "I schedule some things, and if it's not on my calendar, it's not gonna happen." So, but I
Wonderful.
appreciate you.
Yeah, you're very welcome. Well, thank you for your persistence and thank you for your resilience. And but before we go, I do want to remind folks to please head over to the myositis.org website, right? So they can check out more about TMA, support, there's education, there's advocacy there. So myositis.org. And you can catch us at rareawarenessradio.org. And Jen, once again, Jen Swisher, thank you for being a guest with us today and talking us through your very, very fascinating story. And I really appreciate it.
Thank you so much for having me, Rich. I really appreciate it.